Welcome to the COPD Foundation podcast. We bring you insights from leading health professionals, inspiring stories from those living with lung conditions, practical advice, and the latest in lung health research. Be sure to subscribe, follow us on social media, and visit copdfoundation.org. Take action today, breathe better tomorrow. Just a quick note before we jump into our topic. This podcast series was created for educational purposes only and is not a substitute for formal medical advice. Talk to your healthcare provider if you have any questions.
Welcome to this episode of the COPD Foundation podcast. I'm your host, Johnny Karenko, a respiratory therapist and one of the educators here at the COPD Foundation. You're just in time for a special discussion on the impact of advocacy for the people living with chronic lung conditions. We're joined by two special guests, Bailey McCrary, a senior manager of advocacy and public policy here at the COPD Foundation, and Phyllis, a lung health advocate who is living with COPD. Together, we will discuss the importance of raising awareness of chronic lung conditions and how each of us can play a role in making life better for the COPD community. Let's dive in. Okay, guys, so can each of you guys briefly introduce yourselves and share how COPD advocacy has become a part of your journey?
I'm Phyllis DiLorenzo. I'm from New Jersey. I'm a COPD patient and also a state captain, which is an advocate for COPD. I'm looking forward to our upcoming impact in March, where myself, staff, other advocates from all over the country will be traveling to Washington, D.C. to speak with our representatives. We have a few things that we would like them to know about and to be able to address and enter into bills and voted on. So we're gathering, and it's something that we do every year. We have a huge impact and gather all our advocates together, and it's a wonderful way for patients like me to feel that we're being heard by the people who write policy, and it's very empowering.
Thanks, Johnny. My name is Bailey McCrary, and I'm the Senior Manager of Advocacy and Public Policy at the COPD Foundation, and I've been with the foundation for almost 3 years now. Advocacy has always been a personal interest of mine. I studied international affairs in college, and I worked as a legislative aide for my state senator for several years after I graduated. When I joined the COPD Foundation, I actually joined in a different department and I didn't work for the advocacy team. However, because I've always loved advocacy work, I did as many advocacy events with the foundation as I possibly could. And eventually I was able to transition to the advocacy and public policy team and work under the leadership of our fabulous Chief Mission Officer, Linda Walsh. And this has been a perfect fit. I love my team. I love working in advocacy, and I love working with the COPD Foundation and with folks like Phyllis. I've now been on the advocacy and public policy team for nearly 2 years.
Excellent. Thank you so much.
Thanks, guys.
So, Bailey, what is the core mission of the Advocacy Center at the COPD Foundation, and how does it aim to impact the lives of people who are living with COPD?
Sure. So our core mission at the Advocacy Center is to work with our local, state, and federal policymakers to increase research funding, improve care delivery, protect access to treatments, and create policies that improve the lives of those with COPD and related lung conditions. So the foundation has 5 main policy priorities that are informed by policy experts, patients, clinicians, researchers, and other experts on our board, advocacy and public policy committee, and our foundation staff. These policy priorities in specific are an increased investment in research and development of treatments for COPD and chronic lung disease, an improvement in the regulatory process for the acceptance of scientifically validated drug development tools to support the advancement of new treatments for chronic lung conditions, access to safe, effective, and affordable oxygen therapy, access to effective, affordable, and equitable pulmonary rehabilitation in person and via telehealth, and stronger regulation of nicotine and tobacco products. So these priorities provide a comprehensive approach to supporting policies that will make life better for those affected by chronic lung disease. And again, these are priorities that are informed by the patient community, experts, and others leading in the world of COPD and related lung conditions. By focusing on these priorities, we're ensuring that comprehensive actions are taken to make life better for COPD patients in the United States policy field.
Excellent. Yeah. So it really kind of sounds like you kind of listen to all of your stakeholders. So to try to make sure that you are addressing quality of life now and in the future for everybody who's affected by COPD. So that's awesome. It's really important. And so, Phyllis, what inspired you to get involved in advocacy efforts, and how has it shaped your personal journey with COPD?
I was inspired to get involved because when I first became aware of the foundation, most of it for me at that point was just getting information, education, and also support from other patients. However, in my previous life as a mental health social worker, I was always very active and active in advocacy for mental health. So when I came to understand that advocacy was a huge part of the COPD Foundation and actually started attending meetings and going to different advocacy events, impact events, I said, this is me. This is what I want to do. And it's just the whole part of having policymakers understand the patients that are behind the policy that's written. It's so important. So that's why I got involved. Yeah.
That's excellent. It's nice that you found a way to continue that passion for advocacy that it seems you've always had, you know. That's absolutely. So, Bailey, can you tell us what type of programs, campaigns, or events does the COPD Foundation organize to foster advocacy, and how do people who are living with COPD or other chronic lung conditions play a role in these efforts?
Absolutely, Johnny. So we have several programs at the COPD Foundation that foster advocacy for COPD, and we absolutely keep patients at the very forefront of everything that we do with these advocacy programs. So part of my role at the foundation is to serve as our captain's program coordinator, which is how I know Phyllis. She is one of our fabulous captains from the state of New Jersey. Our captain's program is our team of advocates, and these advocates can be COPD patients, patients of related lung diseases, their caregivers, their friends and family, their healthcare providers, and just anyone with a passion for lung health from around the world who volunteer their time and their resources and their expertise to serve as community leaders alongside us at the foundation. Our captains spread awareness for COPD in their local areas. They mentor other COPD community members, and they participate in several grassroots advocacy and community building activities that focus on health policy issues that are important for those with COPD and related lung conditions. We have nearly 200 captains in our program, and we represent 42 states in the United States and 8 countries worldwide. So we are an international program, and we're very proud for the representation there. Our captains are really our key playmakers at the foundation for executing our policy priorities. So those priorities that we discussed earlier, they really cannot be executed upon without the voices and the actions of our captains. So we're very, very thankful for all of the hard work that our captains put into advocating in their free time and using their expertise. They meet with their lawmakers to discuss these priorities. They participate in panel discussions and health fairs, and they speak with reporters. They host exhibits, and overall, they just promote this critical advocacy and awareness messages within their own communities. Most importantly, our captains inspire others to take action to make life better for those with chronic lung disease. And our captains program is really just a beautiful, self-fulfilling community of people who are inspired to advocate for this important message. In addition to the captain's program, if you aren't as comfortable with committed, consistent advocacy, we have an advocacy tool on our website that anyone can use. We call it the Advocacy Action Center, and this is a tool that advocates can use to easily and effectively engage with their lawmakers to encourage their support for our policy priorities. The tool is integrated on our website, and it provides advocates with information on our policy priorities and pre-written messages that they can personalize and send to their lawmakers with just a couple of clicks. So we really like to meet people who are interested in advocacy anywhere that they may have a desire to relate to us and to share our message and to contribute whatever they can. The final program/event that I want to mention is Impact Lung Health. Impact is our annual legislative advocacy campaign that we have designed to encourage the United States Congress to support these policy priorities. So each year we have chronic lung disease patients, their loved ones, caregivers, healthcare providers, and any other champions who like to join us travel to Washington, D.C. with the foundation to share their stories and make their voices heard for those affected by lung disease. During Impact, our advocates learn about our legislative priorities, and they're empowered through our training, relationship building, and teamwork. The event ends in a full day of legislative meetings at the U.S. Capitol, where we meet with our lawmakers and their offices. And I love Impact more than anything because not only does it equip lung health advocates to engage with their elected officials, which is such a huge and important skill to have, but it creates a positive change for people in the United States to directly promote these policies to advocate for millions of people with COPD and lung disease in the U.S.
Absolutely. So, Phyllis, from your perspective, what is the most powerful way that someone living with a chronic lung disease can make their voice heard in advocacy efforts?
I think the most powerful way you can do that is, I don't think there's really one way. I know that for me, I like the live events. I like to be in front of someone one-on-one. That's my personal preference. But for someone else, it might be phoning their representatives. It might be writing a letter. It might be doing a Zoom meeting on Impact Day with your representative or staffer. And that's another thing that I wanted to mention. Oftentimes, people think, oh, I'm going to advocate and I'll be meeting with my representative. You probably won't be. You most likely will be meeting with the staffer, but they have your representative's ear better than anyone else. They do the hard work. They do the research on what you are telling them, and they put the presentation together in a way that is more likely for your ask to be understood and heard. So don't be disappointed if you're not meeting directly with a representative. A staff member is wonderful. They're really interested in what you want from your representative. So, yeah, that's about it for me. Yeah.
So using your strengths essentially, because anytime I hear Phyllis speak, she's so powerful. I mean, I swear the first time I heard you speak at Impact, it took my breath away. And then I was your partner. So I got to continue with you. But not everyone necessarily that verbals their strength. So if writing is your strength or phone calls are your strength, is that, kind of what you're getting at?
Exactly, because for me, a phone call is not my strong point. I never was a phone person. I have fallen in love with Zoom because I can see people's faces while I'm speaking to them. So, for me, I think about that, and I know we're all different. We all have our strengths and our comfortabilities, and that's fine. If you like to write. Send emails. Send as many as you can. If you like to make phone calls, light up their phone, So, yeah, it's, whatever strength someone has, you take it and you run with it.
Absolutely. So, Bailey, I'll start with you, but then Phyllis, I'm curious of your perspective as well. What are some of the biggest challenges that you guys see facing the COPD community, and how do you address them in your advocacy work?
Yeah, absolutely. So despite its prevalence, COPD is still a highly stigmatized disease. And this, what we call the shame and blame associated with chronic lung conditions, can lead a lot of people to deny their symptoms and delay seeing a doctor. This is very detrimental to a potential COPD patient because by the time their symptoms are severe enough for them to feel like they need to seek help, it's possible that a significant portion of their lung function has already been lost. The lack of diagnosis also means that COPD is much more prevalent than is reflected by statistics in the United States. It's estimated that in the US, while there's roughly 15 million people diagnosed with COPD, the actual number of individuals with the condition is around 30 million. And this is why awareness, in addition to advocacy, is so important. We're working to not only advocate for our policy priorities that'll make life better for patients, but we also want to spread awareness of COPD and change the public perception that a COPD diagnosis means your life is over. Our patient advocates work so hard to show their communities and the world that those with chronic lung conditions can live fulfilling and productive lives with the right treatment plans and the supportive network of healthcare providers, loved ones, and their community. So in addition to the very cut and dry policy priorities and talking points and trainings that we go through, our captains program really is a group of people who just keep the hope and put their best face forward and really are a fantastic voice for the patient community.
Phyllis, do you have any perspectives on that as well? Barriers or challenges that you see and kind of how you try to address that?
Barriers in terms of advocacy as well as just everyday life for most COPD patients. Yes, there's a huge stigma that we have to fight. It's still there, unfortunately. It's been entrenched as being a smoker's disease and something that people have done to themselves. And while, yes, many with COPD are former smokers, many never did. And many are getting diagnosed at a much younger age. And it's all due to environmental and so many things. There's so many different genes that could be activated. Now I'm getting out of my comfortability zone, but if you have lungs, they can be affected. It's as simple as that, by the environment, by forces beyond your control. Some people, God bless them, they live lives with healthy lungs. God bless them. Some of us don't. It's as simple as that. And we need to get to the people who are living in communities that are underserved and are not yet diagnosed, because there's many. And that's who I would like to see us advocating more for, people who have yet to be diagnosed, as well as those of us who are diagnosed and receiving treatment.
Yeah, it's a shame that we have this shame and blame associated with COPD because, as you mentioned, cigarette smoking is not the only thing that puts someone at risk for COPD. And even if someone has smoked, okay, well, if they're having symptoms, we should still be treating them, as an individual who we should be treating like a person and giving them the best option to be able to live a good, effective life. Absolutely. Phyllis, you and I were talking earlier about, all of the fragrances and cleaning products and all that other stuff that, many people don't even think about that put us at risk, So absolutely. So can you share a moment or a story from your advocacy work that really stands out as particularly meaningful to you?
I was meeting with the staff of my congressional representative, and for some reason, we seemed to strike up a good rapport. And I had an inkling that he was a smoker. And I actually could smell it. So I said to him, I said, if you are smoking, no matter how young you are, you need to have a pulmonary function test. He was like, what is that? And I explained it to him. And Johnny jumped in as well and explained what the pulmonary function test was. And he was amazed, and he said, we have to get this out. I have to. And he just seemed overwhelmed with the information that we gave him. And he was shocked to hear this, that, someone so young could become ill with COPD. I think he was in his 20s, maybe early 30s. And yes, it's very possible. So
absolutely, yeah. I remember him saying, everyone should have, these pulmonary function testing. We're like, well, we're working on it. Yeah.
So, but I think, and the other thing that really struck me doing these events is how many people are supporting us. Other organizations and just people from the public, who respond to our messages or another organization's message about these events. The people who do come out either in person or with phone calls or with emails, they're there. We may not see them, we may not be aware of them, but also being a board member as well, yes, we're aware of how people are responding. So, yeah, it's great.
Good. So, Bailey, how do you make sure that the lived experiences of people with COPD are central to the foundation's advocacy efforts?
Yeah, thanks, Johnny. This is so important because our advocates are the heart and soul of our advocacy mission at the foundation, and everything we do at the foundation is patient-centric. We're patient-founded and we're patient-led. We have patients on our board, on our staff, on our committees, and in our captain's program, of course. And our patients provide their insights and their feedback on all of our activities throughout the entire foundation. When we do grassroots advocacy, we put patients and their stories first above everything. We keep very organized records of our advocates' legislative districts and their specific strengths. So as Phyllis mentioned, we play to everyone's special abilities when we are connecting advocacy opportunities with each other. So we are able to connect patient advocates to influential opportunities for them to share their stories with lawmakers if that's what they like to do. If they want to write something for us on the blog, on for us to share on Facebook and COPD 360 social, to attend public events like speaking engagements and health fairs. We make sure that we elevate the patient voice in every opportunity that we get, because the voice of the patient is the most important thing that we highlight in grassroots advocacy. So we do what we can to amplify this.
Excellent. Thank you so much. Phyllis, if you could share one message with someone who is newly diagnosed with COPD or another chronic lung disease, what would it be?
Connect with the COPD Foundation. That is where you will find support, education, information, factual information, and other patients just like you going through struggles that you're dealing with. Maybe they've dealt with them in the past, or maybe they're dealing with them now. And if we've been through them, maybe, we can offer some tips. And it's a great community. And if you want to get involved in advocacy, there isn't a better way. They will hold your hand. They will train you. You will know what you're doing. You're not walking in there blind. So, yeah, it's a great opportunity for patients, and it's so empowering to be heard. It really is.
And Bailey, what advice would you give other organizations or professionals who want to amplify their advocacy efforts in a meaningful way?
I would recommend that all organizations who are involved in advocacy take the time to really get to know their advocates. So, as Phyllis mentioned, something that's, I think, unique and special about our advocacy program at the foundation is that we really take the time to meet all of our advocates where they are. So we know that this is something that isn't a one-fit opportunity for everyone. And we know that some people like to speak or to write or to post. Some people might have a couple hours a day to work with us. Some people might have 30 minutes a month to work with us. And we know this and we respect this. So I would recommend that organizations take the time to really spend some time building a rapport with their advocates, because they're the reason that we're here. And their connection to the real world impacts the work that we do every single day. Advocates contribute their time and energy and expertise to our cause. We are eternally grateful for this. And they also provide us with feedback about how our advocacy and awareness strategies are working in their communities, because once again, this is not a one-size-fits-all campaign. This is something that works 200 different ways for 200 different captains. So getting to know captains on a personal level is something that I am extremely, extremely grateful for. Captains like Phyllis make my job the best job in the world. They make my job very easy. And it makes me excited to show up for work every day and to show up to events like Impact and being surrounded by our team of captains and their loved ones.
So are there any upcoming campaigns or events or initiatives that you'd like to take the time to highlight?
Yes, we have our annual Impact Lung Health campaign coming up in just about a month, in this coming March in Washington, D.C. So we are going to be on the ground in D.C. on March 3, 4, and 5, 2025. We are going to have a dinner with all of our advocates on Monday when everyone comes in, a chance for everyone to either get reintroduced to each other, or we have a lot of new faces coming this year, which I'm super excited about. We have right now the best registration numbers for an in-person Impact ever, which I'm also super excited and thankful for. On Tuesday, we're going to have a full day of training, which is also something that we're doing for the first time this year, as opposed to a half day of training or just a couple hours. And then on Wednesday, we have our full day at Capitol Hill, where we're going to meet with our lawmakers and advocate for our 2025 policy priorities. On top of the advocacy that we're doing, I think that the fellowship and the community aspect of Impact is super important, because this is when I got to meet Phyllis in person for the first time, and you, Johnny, in person for the first time for 2024. So I'm just so excited and humbled to see Impact continue to grow as we continue to plan it each year. I'm just cannot wait to report out on what we accomplished this year.
So Phyllis, what's your hope for the future of COPD advocacy, and what keeps you motivated to continue this work?
What keeps me motivated and hopeful is I've been seeing the growth of the foundation in terms of members and different activities and different ways to advocate. And there's something for everyone, whether you want to do a table or do phone calling, writing letters, emailing. There's so many different activities and more opportunities for us to get together and work together. And that has been so wonderful. Seeing the growth of the advocates. Now, everyone isn't involved every day. I'm a little OCD with my COPD and my advocacy. But, that's me, and that's fine. I love it. I love what I'm doing. But, you understand that people have their time limits and, whatever is going on, that's fine. We're grateful for however much time they can spend with us. And we need you, and they need us, to be honest, I think that, we're the best in getting the information and education and support. Like Bailey said, getting to know the advocates on a one-on-one basis, knowing what everyone's strength is. That's what the foundation does best. They build relationships. You're not just a patient. You're not a number. You are part of the family. You are a friend. And it's really felt, and I'm so grateful for that.
So Bailey, how can listeners who want to support COPD advocacy get involved, and how do they get started?
We would love to have everyone listening join our captain's program. We know that this is something that is so rewarding to those who do join it. And we have information about this on our website. Our captains meet monthly to receive updates about our advocacy and awareness activities and share about their work in their own communities. If you can't join our monthly meetings, we have a monthly newsletter to catch everyone up. As I said, there's no minimum time commitment to join the advocacy program. There are no membership dues. You can just go to our website under the Take Action tab. There is a page for the captain's program and a link to an application. You can also check out our Advocacy Action Center on our Take Action tab on the COPD Foundation website as well for information on our active advocacy campaigns and very easy steps that you can take to send a message to your lawmakers.
Thank you for joining us today on the COPD Foundation podcast. I'd like to thank both of our guests for sharing their stories, experiences, and passion for improving the life of people in our COPD community. Remember, advocacy starts with awareness. Whether you're attending events, reaching out to your representatives, or just sharing what you've learned today, every action counts. If you've enjoyed today's conversation, make sure to subscribe and share with other people. For more information about COPD and other chronic lung conditions, visit the COPD Foundation website at www.copdfoundation.org. Thank you for tuning in. Be on the lookout for more episodes where we delve into all things respiratory. Take action today, breathe better tomorrow.
Thank you for tuning into the COPD Foundation podcast. And remember, whether you're managing a chronic lung condition, providing support to those who are, or just want to learn more about lung health, the COPD Foundation is here to support you. Be sure to subscribe to this podcast and follow us on social media. Take action today, breathe better tomorrow.